My name is Aurelie Tran, and I am a first-year medical student and one of the clinic directors for the UofM Student-Run Free Clinic.
And my name is Arushi Mahajan. I am also a first-year medical student, and I do internal operations for the clinic here.
You talk briefly about what you mean when you're talking about a community clinic.
Yeah, absolutely. So I guess the idea came up seeing a lot of the struggles we were having with our patients at the free clinic. It's a generally low resource area in terms of healthcare for folks on Medicaid or Medicare or people who don't have insurance. So we wanted to be able to have a space that incorporated community building, putting skills and resources in the hands of the community that we're serving, and having this all in one location so that it was more holistic than just a medical visit or just a social work visit, just to acknowledge that people really have a lot of different components to them, and that we can support all of that with the resources that we have. So since we already had healthy habits happening at the library, we knew this was a lovely space that was already doing so much for the community, and so we thought it'd be a wonderful opportunity to partner and try to use this as a space where we can team up in providing holistic healthcare services to the Pinckney and Livingston County community.
And when you're talking about holistic, what does that entail?
Yeah, so providing medical services, doing certain medical consultations through the medical school and the nursing school. We have social workers coming out to do interventions with people, to talk through any resource needs that they might have. We have insurance counselors, we have legal support, legal aid, and we have pharmacy people doing medication things, dentistry, so a lot of different diverse people providing a whole wide range of services.
So why the Pinckney Library?
Sure. So Pinckney is a community that the University of Michigan, via the Free Clinic, has an established relation to. So our students over all 4 years and our interprofessional partners, like those in the nursing school, have all come out to the clinic and had some exposure to the city, which I think that all of us can say very easily we're very grateful for. And so despite the fact that some of these relationships aren't longitudinal, I feel like all of us feel some kind of bond with the community. And so in regards to picking Pinckney as the city we want to work in, there was no second thought about it. To answer the second part of your question, why the library? Growing up, I think we both experienced, and many of us have experienced, that the library was really the heart of a community. And I feel from our conversations that the Pinckney Library is the heart of your community here, and it's very close to the clinic, and so on a variety of levels, it makes a lot of sense. And by your blessing, we're really grateful for the opportunity to work via the library.
I know that this is going to be like the first time that we're going to be doing this, but how much of a responsibility do you feel like the library would have to, put in towards this community clinic that you're thinking about?
Yeah, I think the beautiful thing about this model is we already have the established resources and infrastructure and policies due to the fact that we're an established clinic. So really on the library's end, it's providing us with the just support morally and the blessing for this project, as well as the physical space,
Yes.
The setup, things like that is really on the library's end where we see this going, as well as distributing publicity that we can provide as well. So I think in that sense, there wouldn't be too much extra responsibility on the library side, and hopefully we can bring everything in and make sure that we're not putting an extra burden, since the library already does so many things.
And are you opening this up to the public, or is this like by appointment only? Or?
Yes, so this will be on a drop-in basis, and that's also a big difference from our clinic. So our clinic does have a couple hours a week that's walk-in, but it's on one day, and if you can't make it for those 2 hours in the week, that's it. And otherwise, appointments take 3 months on average to get. So this is going to be open to anybody in the public. They don't have to be a prior patient of ours. They also don't even have to live in Livingston County. If you're someone who comes to the Pinckney Library for whatever reason, you're welcome to get whatever services and as frequently as we're here.
And as the name implies, it's a community clinic, so we're hoping that the people who come will develop a community amongst themselves, and so through communication with their own friends and hopefully through our communication, that community will just grow continuously to whoever's interested.
Yeah.